Hello, viewers and listeners. You are welcome to another edition of the program Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. I'm your host, Hajara Usman Attajri. Shisha, often misconceived as harmless social activity, possesses significant health risks to Nigerian youth, with trending issues in Calabar, Cross River State, where young girls aged 15 to 30 highly involved in shisha. This flavored tobacco mix is inhaled through water pipe and is mostly consumed in urban areas. Shisha smoke contains toxic substances linked to respiratory issues, cancer, nicotine addiction, with experts warning is as harmful as cigarettes. One session equals over 100 cigarettes. With rising cases among Nigerian youths, we need to get in and protect our youth. The National Drug Law Enforcement Agency (NDLEA) is working to tackle this issue, but awareness and enforcement still remain critical. In today's edition of the program Midday Vibes, we will be discussing on how we can protect our youth from taking shisha. And joining us in the studio is Commander NDLEA, that is National Drug Law Enforcement Agency Sokoto State Command, in person of Mustafa M. Gidado, who will share insights on the enforcement and prevention. Let's dive in and discuss on how we can save our youth from this silent threat. You are welcome to the program, Commander.
Thank you for having me.
With the growing threat of shisha use among Nigerians, especially here in Sokoto, what do you think are the factors driving this youth into taking shisha?
Bismillahirrahmanirrahim. First of all, we have to look at what is shisha itself. After defining the shisha, then we'll be able to know the consequences and the implications of taking this substance. Shisha, as we rightly know, is a substance of abuse, mostly by youth, women, and youth organizations. They are the ones taking this kind of drugs. So shisha was brought in from the Arabian countries, where it was used freely there. But the problem is not even in Nigeria. What we are talking about is what is involved in the shisha pot. The shisha pot contains water and smoking pipe, as you rightly said. But what they were putting is the aroma that we're talking about. What are they using in that? Sometimes you discover that it's not only the ordinary shisha that they are using, but the flavor in it is the one that is causing problems, particularly among the youth. Because not only the ordinary this thing that they are using, but sometimes you discover that they are putting a lot of things in it, particularly these intoxicants, like cannabis sativa, that we popularly know as Indian cannabis sativa or Indian or weed in northern part of Nigeria. So this is where we got it from.
So what are the factors driving Nigerian youth into taking shisha?
You see, everyone has his rhythm with taking or abusing drugs. And it varies, surely. Some of them, if you ask them, maybe it's peer group that put them in it. Some of them, they will tell you that they have some personal problems. If they took drugs, maybe they'll forget about it. But usually what ginger them to it is mostly this peer influence. These peer groups, sometimes if you are in them, if you are not taking it, they will see that either you are a local person or you are not even enlightened or you don't know what is happening. So you discover that they have to start smoking this shisha just to belong to a particular group, so that they also belong to that group.
So how widespread is shisha used among Nigerian youth? And what's the demographic most affected?
From our statistic of arrest and seizure, usually the youth are the most vulnerable group. They are the ones that were involved between both men and girls, between ranges from the age of 16, 17, 18, 19, 20. Discover that they are the one usually that is taking this kind of substances. This is the range that I'm telling you in this manner.
What? Okay. So the demographic most affected areas.
I don't know, the vulnerable people are usually the youth.
Okay.
It is the youth. You discover that even though some elderly and aged group, you discover that they are taking it.
So how does shisha use impact young people's mental and physical health?
Like any other substance of abuse,
Yes.
shisha is also among the substance that if they use can also affect their welfare. It can affect their health. It can also affect their brain. So that is why we are talking to people that before you start, you know the consequences of what you are doing. Usually this youth group that you see doing it, they don't know the consequences of their actions. And by the time you don't know the consequences of your action, you can do anything. It was later that you discovered that you have taken the wrong part of your life. And that concept, we try to bring them back. We enlighten them and tell them the truth about what they are doing so that they will know the consequences before they start.
What's the link between shisha and antisocial behaviors like prostitutions and other criminal activities?
It is the saying that by the time you take drugs out of people's life, you have a free life. Most of these youths, it is the youths and the drugs that is a catalyst. It is the one that propel all the activities. So by the time you remove that drugs in them, you see they will have a very good social behavior. So by the time they get, I was talking sometimes that how can a sane person, somebody that know what you want, you carry a knife or you shoot somebody or you dagger somebody just like that without the influence of this substance of abuse. So this substance abuse traditionally or whatever means, the repercussion that other drugs are causing is also in shisha and using. So people should be very, very careful. They should be mindful of their activities and they should be mindful of friends that they are going out so that they can avoid this kind of thing that we are talking about.
How effective is shisha campaign? How effective are current awareness campaign about shisha use?
Okay, when the chairman chief executive Jarabuba Marwa came on board, now he's in his second term, he discovered that what we are doing is just arrest and prosecution, and it is not working. So he now tried to change the narrative. Changing the narrative in the sense that he want to give a philosophy where people will be involved. Community leaders, schools, the NYC, any other stakeholders, will bring them together. We call it WADA. This WADA is War Against Drug Abuse, and it is working. So this WADA involves, as I have told you earlier, the community leaders, traditional rulers, and other person that we can work and team up with them in campaign and rallies so that people will know the consequences before they start. They should know what they are doing. So they should desist from that issue of drug abuse. As other drugs related, also shisha is also involved in that. And they should be careful.
So are there specific laws regulating the use of shisha in Nigeria and how effective are they?
Yeah. Normal tobacco, we call it socially accepted drugs. Shisha without these ingredients in it, also essential drugs that we can call it, like tobacco. You can smoke cigarette and nobody will arrest you. So the playbook is the one that we are talking about. Nobody used in smoking this shisha can take them to other use of drugs that we can take and prosecute somebody in the law of court, in the court. So they should be careful because we have rules and regulations guiding whatever we are doing, and they too will be involved. By the time we arrest you with this kind of shisha, we are not going to leave you. We will do what the law say about taking this, and we have the laws. They are working.
But experts warn that shisha is as harmful as taking cigarettes. So are you not considering taking it against the law? That taking shisha and cigarettes, since it's affecting those taking it, like they estimated that one session of shisha is equivalent to 100 cigarettes, and it's affecting respiratory issues and it's causing cancer and it's causing nitroxic addiction. So is your organization looking into those issues and provides rules or laws to regulate those kinds of
As I have,
substances?
yes, I have mentioned to you that Shisha, the flavor is our concern. There are some flavors that you can take just like a cigarette, and we don't arrest such kind of flavors. Right now, as we are, I am talking to these Shisha groups who are directly selling it in Sokoto. And next week, inshallah, I'll be having a meeting with them. Our concern is the flavor. What kind of flavor are you selling to this place? Can you put it inside the Shisha? If it is ordinary tobacco that you are selling inside, we don't have any problem with you. We can do your business. But there are some of them that contain bad nutrients that can cause this one that you are talking like cancer, or it will make somebody to become an addict. By the time you start taking anything like these substances that we are talking about, you can be an addict. And by the time you become an addict, you will never come out of it except with the assistance of therapists. And these therapists are the ones that can advise you, they can counsel you, rehabilitate you, and take you back to the society. And these are what we are trying to avoid. But these flavors are the ones that are our concern. And sometimes you discover that not only the flavor that they are selling in the market ordinarily, they will go and buy substances like the cannabis sativa and put it inside. This cannabis sativa that we are talking about, we have about 3 of them. We have the one that we know in Nigeria, this cannabis sativa that we are talking about. And then we have loud, Canadian loud. It's also affecting the people's life. So there are other kind of this cannabis sativa that we're talking about that we don't want them, and some of them are directly putting it inside as the flavor that they're taking. And we have arrested so many like that, and we have prosecuted so many like that.
Are Shisha vendors adequately regulated? And what's been done to those that operating on that? What's been done to the unlicensed ones?
We don't give them license because they are business people. We are dealing with illicit substances, while NAFDAC are dealing with the illicit. That is the one that the law allows people. So we don't have their records of you, Mr. A, Mr. B. We register you as the one that is selling this Shisha now. But we try to bring them together. You know, they are businessmen. We cannot stop them from doing their business, getting what they are doing to take care of their families and the rest. But what we are trying to prevent is for them to allow their stores to be selling this kind of flavors. And these flavors are the ones that are causing problems to humanity. So that is what we are trying to avoid. And they are actually business people. They have stores and they have rights to sell all this one, just like anybody that is selling cigarettes. But those flavors are our concern. If you know you operate a shop where you are selling Shisha with the pot and whatever ingredients that you are selling, you can sell it. But we are trying to put a halt to all these activities of selling these flavors that are harmful to our lives, to our youth's life, and to our girls' life and the rest. This is what we are doing. That's why I'm telling that we are trying to have a meeting with them. And time to time, we will be visiting their stores to make sure there's compliance in what they're doing.
What strategies is the National Drug Enforcement Agency and the NEA is using to curb Shisha use and trafficking?
Usage? Okay, and trafficking. First of all, I have told you, we are now running on 2 fronts. The arrest and prosecution side. And then the other sensitization aspect of what we are doing. So that sensitization, we took it very serious. We are trying to sensitize even not only the Shisha dealers, but any other person, community leaders, traditional rulers, imams, pastors, all were involved in this war against drug abuse that our chairman Jarabu was launched in 2022 by the late President Muhammad Buhari. So we are on it. It is that war against drug abuse that we are doing to inform people, to sensitize them on the dangers of this so that they will not even start. Those dealers of this Shisha dealers from the port, whatever that they are selling, the ingredients and the rest, we make sure that they only deal on illicit, not illicit substances that they are selling.
What penalties do those people use for selling Shisha face in Nigerian laws?
In Nigeria, anybody that sell, that is the jurisdiction of the court. It is the court that will decide how long would that person going to be in prison, or sometimes you discover it is only a drug user. We call them victims. So these victims are not the people they are taken to court. So anybody that was caught with this shisha and he's selling it to the public, one causing problems, we take him to the court. We have the rules. The laws are there, specified. So it is the judge that will determine how many months, how many years. It depends on the capacity of the other guy is dealing. So that is how the judge will sentence him.
Okay, viewers and listeners, it's still your show, Midday Vibes. Coming away from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. We will take a short break and we will be right back. Please stay with us. Welcome back. In case you've just joined us, this is Midday Vibe. Coming away from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. And right here at the studio is Commander NDLEA Sokoto State Command in person of Mustafa M. Gidado. And we are discussing about the growing trait of shisha use among Nigerian youths and how we can protect our youths from this silent trait. You want to be part of this conversation, the number to call is 090-6000-2022. Commander, you're welcome back from
Thank you very much.
So how does NDLEA address peer pressure and social media influence on shisha use?
I have told you right earlier that what we are doing is the issue of sensitization. This sensitization, we collaborate with media houses like the one that I'm doing now, with traditional rulers, and I have told you with other social groups that we talk to. We cannot be going house to house and tell everybody that this is what you are going to do. But using the media, we can go far. And that is what we are trying to do so that we can tell. And there is one flavor that these people are using in that shisha that I forgot to inform you. They call it this Doha.
Doha.
This Doha, D-O-H-A. So this Doha is called a cause of concern to us. Because after using the cannabis sativa that I have told you and other drugs that they are using, this Doha is also what they are also using. And this Doha is the one that is causing more harms now in Sokoto from our own experience. Sometimes back, it's not only a month that a lady came to the office, reported an issue like that. And when we invited the people, we discovered that this is what they are giving that guy. And we have to warn them for the first time. And then we counsel them and we talk to them so that they understand what they are selling to the people. And by that, they also tell us that by special grace of God, they will never sell this Doha again. It is working. From our experience now, that the level that they are selling the Doha now has gone down considerably. So that is what we are trying to do now.
So what type of effect does this Doha that you mentioned have on youth?
The Doha, we cannot say it has an effect like the cannabis sativa, but also it affects our brains. It's also becoming very, very addictive. By the time you start using it, you will not stop. And it can generate into cancer too. Because all this, even cigarette, it can cause cancer. There is warning there that you are liable to die young if you are using these substances. So this is why we are warning people that they should be careful in whatever they are doing. Know the consequences, know the repercussion of what you are doing before you even get started. So this is how we are talking to them.
So what's the biggest misconception about shisha that Nigerian youth needs to know?
People should know that whatever government is telling people, all the medical personnel are telling people not to do. To do that something that they have seen in it. And that is why they are telling you not to do. You are not a professional. And you don't know why you're doing this. In our rehabilitation center here in Sokoto, if you gather them and ask them why they are doing this, they don't know why they are doing it. From this, you are there from that God protects that we are talking about. Heart, the lungs, the liver are all in your chest. And these organs, they don't like this thing that we are doing. You put pressure on them, and by the time they relapse, you discover that they have serious health challenges. So that is why we are trying to tell them that they should not do it because it is harmful to their life, it is harmful to their parents, harmful to whatever they think they are doing with their own life. So this is the area that we are talking to them through sensitization.
And what support system are in place for youths that are already addicted to shisha?
Good. Not only shisha, what they are doing usually are three things: arrest and prosecution. That is what we are doing. And the second issue is to inform the general public about what we are doing. We are telling them the consequences of their actions. And then the third one that we are doing is try to help those ones that I have told you that they are users. We call them victims. These victims, some of them are doing knowingly or unknowingly. But those ones that are doing unknowingly and even knowingly, we put them in our rehabilitation centers. By the time we catch you, you are doing it, you are using drugs, we put you for some days for counseling. And we are sure, or we can see in you that you are okay. And you are abiding by what the advice that we are giving you. And we can allow you invite your parents to come and be a small family counselor on why this boy is doing this, so that you people should know it is not only our responsibility, but also the family has to be involved. Then there are some that the parents themselves brought them to the office after they discover that there is something in them like this issue of drug abuse and they are disturbing the house. So we put them like 3 months and 6 month counseling and rehabilitation, whereby at the end of the session we take them and reintegrate them back to the society.
You've mentioned that like what you just said now, that there's rehabilitation centers for youths that are addicted to shisha. So what's the success rate?
Currently, while I'm talking now, we have about 26 clients in our custody, and in the format that I assumed duty in Sokoto, I have 12. We have, from our statistics, we have arrested about 146 people, and mostly those people that we arrested are users. The dealers, we take them to court. And those ones that we know they were involved in the usage, we take them for this counseling and rehabilitation session. And by special grace of God, those ones that we have cancelled, only 2 of them relapse and they have gone back. Most of them, they will reach almost 100. We have never had any incidents of somebody getting relapse that he has gone back and smoking again.
How do you think parents and communities can help prevent youths from taking shisha?
We are talking to the families. We are urging the communities to put eye on whatever their children are doing. By the time you discover it is 7 o'clock by your time, you didn't see your daughter or you didn't see your son, you have to find out where are you, where is that child. You have to know. Putting eye is on whatever your children are doing and who are their likelihood their friends. These friends, sometimes they may be bad boys. And if you allow your boys to be following these bad boys, it is unfortunate that they will also be in that manner. The saying that, tell me your friends, I tell you who you are, is a very good concept. People have done it. So all this one that we are talking about is that parents, they should put eye on their children. We watch their activities and who are their friends and what are they doing. What time of the day are they coming to your house to come and sleep? So you have to be up and doing and put eye on this and be talking to them in a polite manner where they will understand the consequences of their actions.
What role can community play in this? Can the community play in this aspect?
The community can come in public enlightenment, and then the issue of giving information. And that information is very vital, is the key, because without the information we can do less. So if you discover there is anyone selling this shisha in your area, or you discover there's anyone that is selling drugs in your own community, when they say what they call them, they say if you see something, Noah, the Noah said if you see something, you must say something. Because if you keep quiet, the consequences and the repercussion will be on your family, it will be on your community or any other person. That is why we are telling you to be vigilant and watch what their children are doing. And then if you see anybody that is trading this drug, either openly or hidden, you should please say something and come and talk to us. And we have numbers that we can even give the public, so that if you see something, they can call those 2 numbers. For the benefit of doubt, anyone that has any information to NDA, you know, some people are afraid that if you tell information, there are some people that will go back and tell the people that it is you that give them. So out of this fear, people will sit down on it and allow the person to be doing what we are doing. So in this administration, I have already mentioned that the Chairman Chief Executive Brigadier General retired has given us a directive that anybody, any officer, anyone that was caught revealing any informant or anybody that come and give us information, definitely there will be a disciplinary action that will be taken against this person. So as you have rightly said, this number that I'm going to give, we have 2 numbers that anytime that we have any information to give, you can give us. We have this 080 38 30 5259. That's also 070 38 40 7549. So if you call these numbers 247, somebody will answer you and then will hear your complaint. Then we are going to leave it. I keep it to ourselves and we'll keep it secret and we'll make it sure that it is in a confidential manner that we are dealing with it.
Thank you, Commander Mustafa. How does a National Drug Law Enforcement Agency collaborate with other agencies to tackle this issue?
These other security issues, security officers, we are all doing one thing. The only goal that we want to achieve is peace, so that Nigeria will live in peace, so that people live in peace and go and do their activities. And go to their market, they can go to farms unmolested, unharassed. And this is what we are trying to do. And then we have a very good collaboration with other security agencies. Military, the police, the civil defenders, all of them. We are working together. So if we have any problem on one is problem on all of us. And then the communities, as I've told you, I have met with several community leaders. I've discovered so many organizations when I came. And now we are still working with them hand in hand. If they have any information, yes. If they have anything they want to give us, we go together. That is what we are doing.
So what message do you have for Nigerian youths about taking shisha?
They should be very, very careful. They should know the consequences of their actions and they should look at their health. People should know the reason why they are doing this. You cannot go and be doing something blindly without knowing the implication of what you are doing. This lack of knowledge about these activities of these youths, particularly the shisha issue, is because they don't know the consequences. If actually they know the consequences and it will land them in a very serious problem, they will know it. But these are some of the things that we are doing through sensitization process. Public enlightenment. By doing that, even not all that heard about what we are saying, definitely majority of them will hear what we are saying. And then the parents. The parents also has a duty bound on them by God that they should take care of their children and then they should know what they are doing. Even the law says man is born free. Nobody is born a madman. So you cannot breed a madman in your own house. So you should try by all means to make sure that you did not breed any drug user in your own family, shisha user or any other drug. You should be careful.
Thank you very much, Commander, National Drug Law Enforcement Agency, in person of Mustafa M. Gidado, Sokoto State Command. Thank you for sharing your thoughts with us and thank you for honoring our invitation.
Thank you very much. I appreciate what you have done.
And with this, we come to the end of today's edition of the program Midday Vibes. On behalf of our production crew and our guest, Commander Mustafa M. Gidado, I am Hajara Usman Attaji. Stay blessed. Until next time.